Hi everybody, it's Carrie. How are you doing today? I hope you're doing well. Today's Thursday, and it's the 23rd of September, and I don't know where you are, but I hope wherever you are, the weather is as gorgeous as where I am, which is near the Houston area. Love fall. It's just such a great time of year. I wanted to talk to you guys a little bit today about having additional procedures done. And if you have to have those additional procedures done, what do you do? I've been in that boat a few times since my original diagnosis, including a major knee replacement surgery. And I know it can be a terrifying decision when you are a patient of a sufferer of RSD or CPRS, and you have to have some sort of other surgery done, because as we all know, a lot of us are patients of this disease because we've had an injury and a subsequent surgery. And so we now have a lifelong affliction because of such an event. But I want to encourage you not to let that happen, not to put off things in your life that you need to have done because of RSD. Because if you do that, then you're allowing yourself to be held captive by this disease. Is it terrifying? Yes. Is it a terrible decision to have to make? Yes. Do you need to think long and hard about it? Yes. But that's kind of in anything we do in our life, right? We have to weigh the pros and the cons, and we have to decide whether or not the decision we're really going to make, is it going to be worth it or not? And if a surgery is needed to fix something or better yourself, or whatever the circumstances may be, don't let this affliction stop you from doing that, because you know what, guys? Life is way too short. And if you can better your life because of an additional procedure, then absolutely you need to do it. Now, you need to do it under the supervision and with the coordination of your pain doctor, absolutely. And whoever you're working with for whatever this procedure may be, you need to make sure that that doctor also understands the complexities of RSD and what needs to happen. And most importantly, what I have learned after a full knee replacement surgery, a major surgery on my other foot, and 2 other procedures on my good knee, I have learned that I have to be able to express my concern and my desire to my anesthesiologist to have additional pain, additional nerve blocks, because that in and of itself is a huge step to prevent you from then having RSD settle in the surgical spot, wherever it may be on your body. Also remember that this tends to happen when it's a limb, an arm or a foot. That's generally where this spreading of this disease generally happens in the process. So yes, it's a scary deal, and yes, you really got to weigh the pros and cons. But if it's something that's going to better your life and give you whatever the results are that you're trying to get from it, then, you know, don't stop. Don't let this get in your way. By all means, don't let this get in your way, because then it's got you hostage. And we all deal with the day-to-day grind of this disease, and it is a day-to-day grind, as we all know. I'm pretty stable at this stage in my process, but that doesn't mean that if I get up tomorrow morning and happen to walk into the street and get hit by a car, God forbid, that could change my whole story. You just don't know what's going to happen in your life ever, and so you can't let this affliction, this disease, control the decisions and make you so terrified that you can't make a decision about a surgery that's going to fix something or better yourself. And I strongly encourage you to take a deliberate approach, weigh the pros, the cons, talk to your pain specialist, make sure you're talking to your surgeon so the surgeon understands this is what you have, and this is what we need to do. And by all means, make sure your voice is heard. You know, we've talked about this before in the medical industry. There's a tendency for medical providers to discount their patients' knowledge, let's say. And I'm a really big believer that when you work with any kind of doctor, that the doctors need to be in tune to what's going on with you and what you're feeling. It's sort of like maternal instinct, if you will. You know your body better than anybody. And so I think it's important that the doctors that you work with also understand and take into consideration how you feel about things. Because if it's important enough, and like I said, I've had a major knee, I'm just recovering from a foot surgery. At this stage, I still don't know whether or not the RSD has spread to that foot. I probably won't know for a few months. Did I have to have the surgery? Yes, absolutely, I had to have the surgery. Is it scary to think about it? Yeah, it is. But I'm also not going to worry about it and dwell on it every day. If it happens, it happens, and it's out of my control. But I've made the informed, intelligent decision, and so I've got to live with that, and I've got to move on. So I just wanted to pop in today and kind of give you some positive reinforcement. If you're dealing with something and you need to have some surgical intervention, you know, just do your due diligence, have faith in your doctors, and I'm confident that it'll all work out for the right way. But I'm a half full, not a half empty person, so I try to always take a positive spin on things and look for things to come out on the right side, not the wrong side. And so I would encourage you to try to do that too, for just in general, because, you know, if you wait for that other shoe to drop, it's probably going to drop on you when you least expect it. So try not to obsess about it, and do the things that you need to do to better your life. We only get one gig, we only get one time, one ride, one turn at this thing called life, and we need to take every opportunity to have the best life that we can possibly have. So that's just kind of my message today. I hope you have a great weekend. I hope whatever it is that you're doing, you get out and you enjoy this beautiful weather, and you spend time with your loved ones, and you stay safe and well. I hope you're well. I hope you're not struggling with this terrible pandemic that the world is currently fighting. And I hope you have a great weekend. I hope you have a great tomorrow. Tomorrow's Friday, and I wanted to get this video done today so I could post it for you tomorrow. I won't have time tomorrow, so I do hope that, as I said, the weekend is a great week. You have a great beginning of next week, and I will catch you in the next video. God bless, stay safe, and I'll see you soon. Bye-bye.